Is your face round and puffy all the time? Have you been trying to lose weight, but it just won't come off? It could be due to a common hormonal imbalance, high cortisol. But how do you know if you have high cortisol levels? Well, first, let's discuss what cortisol is. Cortisol is often called the stress hormone, and while it's essential for our body's response to stress, too much of it can lead to various health problems. So, how can you tell if your cortisol levels are higher than they should be? Let's dive into some of the signs, symptoms, and how you can get a diagnosis. First, let's talk about some common signs and symptoms of high cortisol. Weight gain, especially around the abdomen, even with diet and exercise. A round, puffy face, also known as moon face. High blood pressure, persistently elevated blood pressure levels. Mood changes, increased anxiety, depression or irritability. Sleep problems, trouble falling asleep or staying asleep. Experiencing a tired but wired sensation at night. Fatigue, feeling tired even after a good night's sleep. And brain fog during the day. Weakened immune system, more frequent colds or other infections. Skin changes, acne, easy bruising, or purple stretch marks. Muscle weakness, especially in the shoulders and hips. If you're experiencing several of these symptoms, it might be a good idea to talk to your healthcare provider. But remember, these symptoms can also be related to other health issues, so it's essential to get a proper diagnosis. So, how do doctors diagnose high cortisol levels? The process typically involves a few-step medical history and physical exam. Your doctor will ask about your symptoms, lifestyle, and any stressors. They'll also perform a physical exam. Blood tests. To measure cortisol levels in your blood, usually done in the morning when cortisol is at its peak. Saliva tests. These are often done at night when cortisol levels should be lower. 24-hour urine test. Measures the amount of cortisol excreted in your urine over a day. Dexamethasone suppression test. You take a steroid tablet at night, and your cortisol levels are measured the next morning to see if they decrease as they should. Imaging tests. Sometimes imaging tests like a CT scan or MRI are needed to check for issues with the adrenal or pituitary glands. Once you have a diagnosis, your doctor will work with you to develop a treatment plan. This might include lifestyle changes, medications, or addressing any underlying conditions causing the high cortisol levels. However, there are many interventions you can do on your own to lower your cortisol that involve lifestyle and habit changes. Reducing stress is crucial. Consider incorporating relaxation techniques like meditation, yoga, or deep breathing exercises into your daily routine. Regular physical activity, a balanced diet, and adequate sleep are also vital in managing cortisol levels. Ensure you're not doing too much high-intensity exercise such as running or HIIT workouts, especially if you are a female, as doing these types of workouts too often can lead to increased stress and cortisol levels. A combination of low-intensity exercises such as yoga and Pilates and limiting high-intensity exercise to 1 to 2 days a week will give your body adequate recovery time and keep your stress levels low. Reducing the amount of caffeine you drink throughout the day is another major component for healthy hormone levels. For women, don't drink coffee on an empty stomach. Drink it with or after breakfast. Limit your caffeine to 1 to 2 cups a day. And don't drink it too late in the day. Women in their childbearing years should avoid fasting, especially if you suspect hormonal imbalance, as it can cause significant distress to the body. Ensure you are getting a healthy balance of macronutrients, including fats, carbohydrates, and protein. Depriving your body of fats and proteins especially can have a negative impact on your hormonal health. Stay away from seed oils and overly processed foods. If you can't understand the ingredient label, don't buy it. Ensure you are getting adequate amounts of sleep every night. 7 to 9 hours is optimal for most people. And stay off that phone right before bed and first thing in the morning. While this is not a comprehensive list, implementing these lifestyle changes can have a massive impact on your hormonal health. High cortisol can be a serious issue, but with the right approach, it's manageable. If you think you might have high cortisol, don't hesitate to reach out to a healthcare professional or a functional practitioner to get your levels tested. Thanks for listening, and don't forget to like, share, and subscribe.